The perimeter is shrinking around homes in Cedar Rapids. More people are being allowed back into their houses, and they are quickly junking belongings. The cleanup process is messy and hazardous.
That ground out there to me is so contaminated. I think the government ought to just come in here and buy this area up.
Dave Hughes is saving what's salvageable, and he's getting plenty dirty in the process. Medical director for St. Luke's Emergency Department, Dr. Ryan Sundermann, says Cedar Rapidians are already getting diarrhea among other illnesses related to the flood.
We've seen some things that I haven't seen before. We are getting patients coming in with an unusual rash on their lower legs, but it doesn't look like it's an infectious etiology. It looks more of a contact dermititis that you'd see from a chemical burn.
Authorities have made it clear that flood victims need to be wary of the unsafe water. Well, that unsafe water left behind a layer of unsafe mud, and that mud is now turning into dry dust and dirt, which is getting into the air. And doctors say it might be a good idea to wear one of these masks while doing cleanup.
Calvin Voelker is helping his family clean up. They are all wearing respiratory masks and gloves for protection.
The sewage is backed up and stuff. It's just really gross.
Everything from sewage, fuel, fertilizer, and the unknown mixed into the water, creating a soup no one should drink. Now it's flying through the air every time a car drives through the dirty streets.
I would never discourage them from wearing some sort of respiratory protection. The stuff that you can buy at the typical hardware store is sufficient probably, unless they're going to have prolonged exposures or if they're going to be doing extensive work in their houses.
Many people are doing extensive cleanup work. Lurking in the debris are health hazards just waiting to jump inside a person not taking the right precautions. Mark CARLSON, The Associated Press, Cedar Rapids, Iowa.